Hello, my name is Jennifer Gitson. I'm a student at Indiana State University in the LVN-BSN Program in NURC 44. This is the Community Health Project number 5, and this one is on diabetes. So the first thing is objectives. We're going to learn about what is diabetes, what are the different types of diabetes, and how does diabetes affect your health. What is diabetes? Diabetes is a chronic health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar and released into your bloodstream. When your blood sugar goes up, it tells your pancreas to release insulin. Insulin acts like the key to let the blood sugar into your body's cells to use as energy. If you have diabetes, your body either doesn't make enough insulin or it can't use the insulin it makes as well as it should. When there isn't enough insulin or cells to stop responding to the insulin, too much blood sugar stays in your bloodstream. And that's how you get glucose levels in the 2, 3, 4, 500s, because the sugar actually never really leaves their body. So there's different types of diabetes. Type 1 is usually genetic. So type 1 diabetes is thought to be caused by an autoimmune reaction. The body attacks its self. That stops your body from making insulin. Type 2 is the diabetes that we can control. So with type 2 diabetes, your body doesn't use the insulin well and can't keep your blood sugar at normal level. There's gestational diabetes, this is when you develop diabetes when you're pregnant. You only have diabetes when you're pregnant. Prediabetes, this is when your blood sugar levels are higher than normal, but they're not high enough to consider you a diabetic yet. So there's different symptoms to diabetes. You have to pee a lot, you're very thirsty, dry mouth, you lose weight without trying, you're very hungry, your vision's blurry, numbness or tingling in your hands and feet, you feel very tired, dry skin, sores that don't heal, and have more infections than usual. So at my work, we have a patient who constantly complains of yeast infection, but it's because her blood sugars are so high, and so her body develops, her sugar's just sitting in her body, and she develops more yeast because of the high blood sugar, because she leaves her diabetes untreated. So what are the risk factors of diabetes? You're over the age of 40 or 45. You have an inactive lifestyle. You don't like to work out too much. Maybe called like a couch potato. You chronically have high blood pressure. That's not taken care of with your medication. You have gestational diabetes, impaired glucose tolerance, abnormal blood lipid levels, BMI above 23, family history. So this is about gestational diabetes. So you previously had diabetes with a previous pregnancy, you're at risk for gestational diabetes. You gave birth to a large baby over 9 pounds, you're overweight, and your family has a history of type 2 diabetes and have PCOS. I never knew about PCOS until I did this. I didn't know that was a risk factor for diabetes. What ways do you prevent diabetes? Eat well. So you can do that by meal planning, grocery shopping, reading the food labels. Try not to eat out, and carb counting. Carb counting is an excellent way. I try to tell patients to keep their carbs under 100 to help bring down their A1C. It's good to work out, you eat fruits, eat vegetables. Try not to eat out, and if you do eat out, pay attention to what you're eating. So diabetes can cause these other problems, or all these problems fall back to diabetes. Neuropathy, a lot of our patients complain so much about neuropathy. You never really know all the things that diabetes affects. Neuropathy, retinopathy, hypertension, dyslipidemia, gestational diabetes, diabetic foot, neuropathy, nephropathy, ischemic heart disease. Diabetes affects everything in your body pretty critically. So the blood sugar goal, a blood sugar target is the range you try to reach as much as possible. These are the typical targets. So before a meal, your blood sugar should be between 80 and 130. But we like to keep our blood sugar below 99. Otherwise, you're diabetic or pre-diabetic. 2 hours after the start of a meal, less than 180. An A1C is a test that your doctor will take to see how your blood sugar has been over 3 months. So a normal is below 5.7, pre-diabetic 5.7 to 6.4, or diabetes 6.5 or above. And if your A1C is 7, then you're living at 154 blood sugar all the time, most of the time. 8, 183, 9, 212, 10, 240. Right now at my clinic, we have patients who are in the 15, A1C 15. Their blood sugar is probably 300 or 400 all the time. Definitely not good for your body at all and your organs. So my entire presentation came from the CDC diabetes education. Thank you for watching my PowerPoint. I hope you learned a little bit about diabetes. There will be a pre-test and a post-test on the box below, along with a little educational flyer. Thank you.